So bladder cancer is the second commonest urological cancer after prostate cancer. And it's the commonest of all the cancers which affect the urinary tract lining, that's urothelium. So males are more affected than females in a ratio of about 3:1. And it's more common in the white race compared to the black race in a ratio of 4:1. More than 80% of clients with bladder cancer are above 50 years. The commonest pathological types are transitional cell carcinoma, as TCC, which is 90%, squamous cell carcinoma, which is 88%, and adeno carcinoma and carcinoma in situ, that's 2%. Now, the causes are chronic infections of the bladder like schistosoma, hematobium, as bilharzia, and chronic bacterial infections. So smoking of cigarettes. Cancer usually develops 10 to 20 years after smoking, and 20 sticks a day or a packet carries a high risk of cancer development. Passive smoking may also carry a risk of cancer. Occupational risks. Environmental exposure to cancer-causing chemicals used in industries, for example, dye, textile, rubber, cable, printing, etc. Also, genetic and familial factors. The symptoms are hematuria, usually painless, painful only in advanced disease and infection or UTI. Also, irritative symptoms, for example, frequency, urgency, dysuria, flank pain, that's hydronephrosis, and pelvic pain from cancer invasion, edema of lower limbs from advanced disease, and it may be asymptomatic in early disease as 25%. The signs that are usually elicited are pallor, wasting, palpable bladder mass, palpable kidney from ureteric obstruction and hydronephrosis, also lymphedema of lower limbs or the limbs, and also secondary UTI in 30% of cases. Investigations are FBC and ESR, urine analysis and culture, urine cytology, urine creatinine, electrolytes, ultrasound scan, abdominopelvic ultrasound scan, CT scan or MRI for staging, usually by a specialist, and special investigations like abdominopelvic IVU, in ureterocystoscopy, and biopsies by specialists. Examination under anesthesia, as by manual palpation of bladder through DRE, that's digital rectal examination, and pelvic examinations. The main treatment objectives are surgical cure for early disease, prevention of recurrence, progression, and metastasis, also management of complications, additional treatment with cancer drugs and radiotherapy when necessary. That's new adjuvant and adjuvant therapy. Non-pharmacological treatments include cystectomy as partial or radical, with or without bladder replacement, and also radiotherapy. Pharmacological treatment, so early stage BCG or Theopita bladder installation for superficial tumors after transurethral resection of bladder tumor as TURBT. As advanced disease, chemotherapeutic agents recommended for advanced stage, in which includes methotrexate, vinblastine, adramycin, and cisplatin. So referral criteria: you refer all cases of bladder cancer for specialist evaluation and treatment. In all cases of chronic cystitis should be referred to a specialist to exclude bladder cancer.